Hi, everyone. Thanks for joining our webinar. Today's topic focuses on the startup specialty practice, what to know before you break ground. My name is Adam, Content Marketing Specialist with Henry Schein, and I'll be your moderator. There will be no live Q&A following today's presentation. If you have additional questions about this topic that cannot be answered by today's presentation, please feel free to email webinars@henryschein.com or Dr. Tholen directly. This webinar is sponsored by Henry Schein Dental, and no CE credits are being offered for viewing this presentation. I am pleased to be joined by Dr. Mark Tholen. Dr. Tholen has lectured extensively all over the world and is the author of 3 dental textbooks. His career in dentistry spans over 30 years, including clinical practice before obtaining his MBA. Thank you, Dr. Tholen, for your presentation. Take it away.
Well, Adam, thank you very much. I enjoy always being here with the Schein team and having an opportunity to share some information and knowledge with my colleagues in the dental profession. So today we're going to evaluate and review the essential elements for each specialty and all the must-have components to make the practice highly productive while minimizing staff stress. And that truly is the focus of this webinar. It's the optimization of production and the minimization of stress for the staff. There are architectural considerations that are common to all specialties. So we're going to begin with this common denominator that of some elements that we're going to be discussing that are ubiquitous to all of the specialties. And most startups are going to be in lease spaces. So let's examine what's most important in the architectural evaluation of a lease space. We're going to begin with talking about the size and the shape of the space footprint. In general, we want to have 500 square feet of office space per operatory or per dental chair. And we want the space shape to be as close to a square as possible. The more irregular the shape, the more unusual elements in the shape of the footprint, the more difficult it's going to be to create a highly productive floor plan. So let's think about what I've just said. If we have a 5 operatory office, then we're going to have 5 times 500 square feet of office space per op. That means we need 2,500 square feet of space in order to adequately size and place all elements of the office in order to optimize our production and to minimize our stress. And the closer we are to a square in the shape of that footprint, the better off we are in being able to ensure ourselves that we can indeed create a highly effective floor plan that will result in the optimization of production. Another element we need to think about is parking. Parking in a lease space building, generally the landlord and the building is going to allocate 3 parking spaces per 1,000 square feet of office space. That's going to be wholly inadequate for you, especially if you're in a medical and dental office building. And so we want to have a minimum of 5 parking spaces per 1,000 square feet of office space that you're renting. That will generally ensure enough space for your patients and your staff to be parking in the facility. Another item that we have to think about is utilities, and especially the electrical service. Now, in the average dental office, we're going to need somewhere between 400 and 500 amps of power. So you want to make sure that indeed that amount of power can be delivered to your lease space. Also, the location is very important. And now I'm not going to talk about exactly where do you go. That's a whole nother conversation. But in terms of the style of the building, that's our focus right now. We want to be in a Class A facility. In other words, think of where banks go. Wherever banks go, that's where you want to be. Okay, that's the kind and style of building you want to be in. You don't want to be in a Class B or Class C building. Class B is more of a business park, and a Class C is literally a warehouse. So so when we're talking to a leasing agent, we want to be in a Class A building. Now, another consideration is columns in irregular perimeters and also flooring issues. But with the columns, let's take a look at what a normal, newer building is going to have. Now, this is a multi-story building, and we need to know the number and the location of columns that are going to be in our lease space. Now, the newer buildings will have a column configuration as shown here, and that can present a problem though. As you see in the diagram, where we have the foot of a dental chair actually lining up with a column. And so we're going to have to be sure that as we do as we do a floor plan, that we're working around these columns. Older buildings are going to have even more columns in the multi-storied configurations. So we want to be sure that we have adequate space in our office. Okay. Additionally, columns must be sufficiently distant from the exterior wall in the clinical zone, so there is adequate depth for the operatory and the clinical hallway. So a general guideline is to add 50 square feet to your floor plan space requirements for every column in your lease space. For example, if you're planning on a 5-op office, you should normally need 2,500 square feet. But if there are 3 columns present in the space, then an additional 150 square feet should be included to ensure you've got adequate space for all the elements of the office. And I think that's, so what we would come up with there is 2,650 square feet for that 5-op office with the 3 columns in the space. Now let's think about irregular perimeters also. Here we have a perimeter of a dental office that has a highly irregular perimeter. And you can see if we're going to put all the dental chairs equidistant from the wall, we're going to have a very staggered configuration. And so we're not going to do that. Obviously, all the ops are going to be exactly the same. They're going to be lined up on a treatment hallway. And so we're going to sacrifice some space. And so as a result, we need to add 50 to 75 square feet to our space requirements per irregularity. So let's take a look at that. Here we have 1, 2, 3, 4, 5, 6, 7 irregular spaces. And so we're going to have to add 7 times 50. Let's just use 50. That's going to be 350 square feet. And if we have a 5-op office, we needed 2,500 square feet to begin with. So now we need 2,850 square feet in order to adequately place and size all of the rooms and the spaces in this office. Other considerations that we need to think about are the building codes. And of course, we're not thinking about that. Our architect is thinking about that for us. And so, but we have to have not just a floor plan, but an entire architectural plan that complies and comports with all the local building codes, especially the fire code. For example, a fire code is going to demand that we have an auxiliary exit. In other words, an exit that is in a specific location in the office that is separate and apart from the patient entrance. And we're also going to have a certain type of building materials are going to have to be used in certain offices, and we're also going to have a sprinkled office in some instances. So there are lots of considerations because we do indeed want to be able to build the office. And if we don't have an office that complies with all the building codes, then we can't get a permit. If you can't get a permit, then the general contractor cannot build the building. So we want to be sure that we're complying with all code. Signage availability would be nice. You want your patients to know where you are. And then, of course, you have to consider the lease rate and the terms. Now, this is actually a big topic to be discussed, but I'm going to make it a very short, succinct answer. You are not a leasing agent. You don't understand how to negotiate a lease with a landlord. For heaven's sakes, get a lease negotiator. Now, you can find them on the internet. Perhaps you can talk to your Schein representative and they know of a local agent, but you need your own leasing agent. They will be worth their weight in gold. They're going to look at all the elements of your lease agreement, and you'll be well served by having a lease negotiator working on your behalf. However, if you are considering purchasing a piece of property, well, that's a little bit different animal. And so we're going to have to be certain that it's adequately sized to support your office, which supports the practice. So as a general rule, we're going to need a piece of property that is 6 times the size of the proposed office to accommodate the setbacks, as you see here in this slide, the building codes, and the parking needs. So let's just go through those numbers for a second. Let's say we're going to do a 5-op office. That means we need a 2,500 square foot building. And if we need a 2,500 square foot building, 6 times that would be 15,000 square feet of land that we're going to need. And if we can, it's great to have the land in a relative square or a squared up rectangle, as you see in this diagram. And then that's going to yield a relatively large buildable area because there's going to be some setbacks, but we want as large a buildable area as possible so we have options about where to put the building on the property. Another common element that should be included in all specialty practices is the stand-up consultation area. It's a very powerful tool to enhance patient flow. You know, you treat the patient in the operatory, but converse with them here because you're describing the care that has been rendered and you're delivering a very distinct message. We're all standing up. This is not going to be a long conversation. And so you're able to have succinct, short conversations. The patient feels served in whatever specialty we're talking about. And then they're on their way. But at the same time, the operatory is being turned over. All right, let's turn our attention now to each of the specialties, and we're going to begin with oral surgery. The design is of the operatories in oral surgery offices is often determined by the procedure focus and whether or not an anesthesiologist is present. And so you can see we've got some different configurations here. Here's just a typical oral surgery op. And I really like the 2 track mounted operatory lights because it really helps with visibility and generally precludes the need to continually adjust the operating lights. Here's just another configuration, another example of a surgical op with a slightly different configuration in the clinical space. And of course, every oral surgery office is going to need a recovery area. It's essential in optimizing patient flow and efficiently monitoring the patients. Note the nurse's station right here in the recovery room. It's centrally located. It can see all the patients at any one time. And of course, when the curtains are drawn, but the nurse is still able to access all patients very easily and very quickly. The location of the recovery room is in the upper right-hand corner of this floor plan. And in this particular plan, it's in the heart of the surgical component of the clinical zone, and it is adjacent to the surgical exit. The exterior of the surgical exit should have a porte-cochere, or that is a drive-through, so the patient can be placed in a car in a sheltered environment. Very important. Moving on to orthodontic and pediatric dental office considerations. The first thing I'm going to talk about there is the clinical zone and the operatory configuration. Many times there's been a popularized pinwheel configuration to the clinical zone, and honestly, that is not very helpful at all. What we want instead, because the traffic there is terrible, you can't control how the children come in and out of the pinwheel. Instead, I would highly recommend this back-to-back format that you see. The open bay is on the right-hand side of this floor plan. I highly recommend it because here you can see the traffic pattern allows the patients and staff to walk in a very orderly fashion and not move through the middle of the open bay, but either to the left or to the right of the bay. And so only the staff members are moving between the chairs and working in the middle of the open bay. All the patient traffic is focused and is funneled to the perimeter of the bay. Here is an example of a back-to-back configuration with the centralized ambient lighting and over the workstations, and then you can see each one of the chairs does have a cart for use by the provider. And of course, a straight line configuration is also conducive to an orderly traffic pattern. Another consideration is a game room for the children, which can also serve as an on-deck sub-waiting room. Here is an example of a sub-waiting room and an on-deck concept that has been applied with a digital monitors and games, and also the bench seating. Of course, brush-up areas are needed in proximity to the on-deck seating. You can see staff working adjacent to the actual clinical areas and the dental chairs. You want them to be able to visualize the patients with continual monitoring, and this open bay concept allows for that. And that's really a great feature of the back-to-back configurations of the open bay that in this floor plan you can see toward the top of the floor plan.
Okay.
And even with side cabinets, the doctors and staff can visualize any patient at any time. And of course, in a pediatric environment, this is critical. And whether the staff is attending to a patient or they're in an adjacent work area, in this particular instance and configuration, they can see everybody all the time. And one other item that I would highly recommend to all pediatric dentists is the idea of using four-handed passes, because four-handed passes are critical to being able to increase your speed. And speed is everything in treating pediatric patients. The quality of the care, though, is not sacrificed. Only the extraneous repetitive movements are eliminated with four-handed passes. And you can see my video on four-handed dentistry on YouTube, and just search for Dr. Mark Tholen, and you'll see a selection of videos, and you want the one that has the working in the operatory and using four-handed passes. I would urge you to consider a marketing theme for your office and carry that through to the architecture of the facility. But remember, it shouldn't look like Chuck E. Cheese. Now, here's a coastal practice using a nautical theme and lighthouse. And so it looks inviting, it looks interesting, it doesn't look foreboding, but on the other hand, it doesn't look frivolous and silly. And so we want to strike a balance between the two in a pediatric or orthodontic practice. And one other consideration for orthodontic and pediatric practices is parking. Okay, this is a typical office at 4 o'clock in the afternoon. So how are we going to be able to adequately provide for parking? Because if you want to kill a practice, one of the fastest ways to do it is to not have adequate parking. So here is the formula. You need 1 parking space for every staff member. You need 2 parking spaces for every dental chair. And you need a 1 parking space for a handicap. And then you need 1 additional space for your spouse, or for maybe the Schein rep, FedEx, whatever. But adequate parking is critical to the success of the practice. Okay, let's take a look now. Let's turn our attention to the prosthodontic office configurations. Now, a prosthodontic office needs to look the part. Aesthetics and function are essential in the delivery of care with a superior result. So you want your office appearance to be consistent and congruent with the level of care you're proposing to your patients. And of course, most prosthodontists, as I said, have a heavy aesthetic component to it. So we want the office to look like we can pretty much pull anything off. One element of a prosthodontic practice that most other practices don't have or need is a production lab. A production lab needs a detailed architectural plan to provide adequate counter space and utilities inside that space. As a general rule, the production lab is sized according to the number of technician staff that will be in there. So we need 150 square feet for the first lab tech, and we need 50 additional square feet for every successive or subsequent lab tech. So let's just say we're going to have 3 lab techs working in the space. We need 150 plus 50 plus 50. So our overall production lab, we're going to at least initially plan on 250 square feet of space for these 3 people to be working efficiently. And generally, there are wet and dry areas in a production lab, and they're sized according to the equipment and the workstations to be placed in each of those areas. Prosthodontic operatory configurations are going to vary according to the training, the techniques, and the focus of the doctor. The craniofacially oriented practices are going to require a different operatory configuration from that of a standard prosthodontic practice. So it all depends upon your techniques and your focus. Here's an example of a production lab, and it's on the left perimeter wall, and it's divided into a wet and a dry area. But there's also a finishing and polishing lab in this prosthodontic office, and it's on the hallway, on the treatment hallway, on the bottom right. And so we've got 2 different types of labs. The finishing and polishing lab, which is on the treatment hallway because staff and the doctor are continually coming and going from that finishing and polishing lab. So it needs to be very close to the operatories. And then we have the production lab, which that's going to be in a much more distant location in the staff zone rather than in the clinical zone. And now let's move on to looking at some considerations for endodontic and periodontal offices. The most prominent feature of an endodontic office and many periodontal offices now is the use of scopes, and whether it's wall mounted or it's ceiling mounted, or it might even be freestanding on a stand, rollers. So we have to decide which it's going to be, and how that operatory is going to be configured with the scope in place. I'm going to recommend that every endodontist and every periodontist are using four-handed passes. I commented on this earlier with the pediatric doctors, and I'm going to suggest that the endodontists and the periodontists, because many times they're working through scopes, they need to be versed in the choreography of four-handed passes. And again, you can see my video on YouTube, and it will describe exactly how those four-handed passes occur, and how you place the instrumentation and the patient and the assistant's workstation, and how the assistant is relating to the doctor as well as the patients. All periodontal offices should have a console room that, like one that you see here in the photo. And endodontic offices that are performing implant placement should also have a consult room. And by the way, the consult room should be consistent and congruent with the level of care you're proposing to your patients. And the architect and the interior designer are going to be the people who actually create this consistency for you. They're going to listen to the type of practice that you have and what you're doing there, and then they're going to start to craft the tenor of the quality of the waiting room, and they're going to manifest the quality of your practice in the materials and in the design of the consult room. If you are using IV sedation, then I'm going to recommend a recovery room be placed in your office. You can see that the recovery room is on the bottom left wall and near the exit, which would be a staff exit, but this is also a surgical patient exit. And that is critical, because we don't want patients occupying the ops while they're recovering, because it's really expensive real estate. Let's use the ops for treatment, and let's use a much less expensive space as a recovery area. You know, we've discussed many different things today, and I know it's been very, very quick, but you have the opportunity to review this information in depth if you care to. I have 2 books that I've written. They're both available on Amazon. One is a guide to designing the elegant dental or medical office. And the other one is Giving Form to Your Future. It's a 100 award-winning floor plans. So again, and also if you have any questions, you can send them to me at Dr. Mark at mynewdentaloffice.com. That's obviously my email address, and I'll be happy to answer any questions you might have. And of course, you can also access webinars at Henry Schein. So with that, I'm going to say thank you. It was a pretty quick tour of specialty offices. I hope that the information has been helpful, and I look forward to perhaps sharing some more information about office design with you in the future.
Thank you, Dr. Tholen, for your insightful presentation, and thank you everyone for attending today's webinar. A link with today's recording will be sent out via email in the coming week. On behalf of Henry Schein, thanks Dr. Tholen for your presentation. Hope everyone enjoys the rest of their day.